And I'd like to invite Jim to come up and kick off the panel with a presentation where he'll provide an overview of what's being done and learnings in the area of physical activity and how we can move forward.
Thank you, Chris. Thank you all for coming back from lunch. I hope you're well nourished and awake. So a pleasure to be here. I have a big scope and a short amount of time, so I'm going to be selective in what I talk about. But the theme is some pathways to a more active America. And this is what a more active America looks like, in case you're wondering. So I'm going to briefly tell about the physical activity landscape in the U.S., and then focus on youth for a bit, a little bit on schools and early childhood education, maybe complementing some of what we heard this morning. Then I'm going to, in honor of the Surgeon General that was here, talk about improving walking and walkability and end with a few recommendations. Physical activity in youth. If you look at this is from accelerometers. This is minutes of moderate to vigorous physical activity with all of these countries' data scored the same, so they are comparable. I circled the country with the lowest level of physical activity, which just happens to be us. And by contrast, you see the average for these 10 countries is about 65 minutes. We're at 46 minutes, and the highest country is 84 minutes, which is Norway, almost double the amount of physical activity that our youth do. So I think this puts a point on it that our children are not just not active enough, they apparently are among the least active that we have data on. These are data on adults. This is self-reported leisure time activity, the percent that meet the guidelines of 150 minutes per week. And you can see there's been some improvement from a low of about 40% to a high of just under 50%. So there has been a recent trend. I haven't heard a good explanation for it, why it started going up in 2008, but maybe somebody will have a comment on that. There are disparities in physical activity. And this is a summary of this for adults. Men tend to be more active than women. Physical activity goes down pretty dramatically with age, as you see, starting in early childhood and going down throughout life. You see some race ethnicity differences, but the education differences are really apparently stronger here than the race ethnicity differences. So there are numerous kinds of disparities in physical activity in adults and somewhat similar trends in youth, which I will not show. So there is a problem with lack of physical activity in this country, but there's been some thought put into what can we do about it. There is actually a national plan for physical activity. It was revised this year, and it's focused around these 8 sectors. And you've heard already this morning that we need to work with multiple sectors, and here is actually a blueprint for how to do so with physical activity. This is a review that came from Department of Health and Human Services about interventions to increase physical activity in youth. And you can see there were only a couple of these that were deemed to be of sufficient evidence. And that was multi-component school programs and physical education. I'll come back to those. There are several with suggestive evidence or building or emerging evidence that looks promising. And then there are several with insufficient evidence. So as a researcher who and a public health advocate who wants to use our resources in the most efficient way, I would say let's start with programs that we have or approaches that we have the most evidence that work, and then work our way down the list, and knowing that no one intervention will be sufficient. Bill Cole led this report along with Heather Cook, educating the student body from a report from the Institute of Medicine. And I want to highlight here the whole of school approach, which in the previous one is the first one, the multi-component school programs. So they were recommending an evidence-based approach. I want to just highlight a study that a former postdoc of mine did that gave further evidence of the importance of having multiple components in a school physical activity program. So we studied about 100 schools, elementary schools in San Diego County and in Washington State. These were not schools participating in a program. These were schools that children went to, and we had accelerometer data on these children. So again, these are schools. This is just the natural variation in what these schools were offering. And so we looked at 5 practices that are listed at the bottom. Having a physical education teacher, providing a certain amount of physical education minutes per week, and then 3 indicators of recess. There could have been things like instant recess or classroom activity breaks going on, but there weren't enough of those to make it into the analysis. And so what you find, what we found, is that schools that had 0 of these effective practices, the children that went to those schools got on average 21 minutes of activity during school, assessed by accelerometer. And the CDC recommends that schools provide 30 minutes a day of physical activity, and that children get the other 30 minutes they need outside of school. So these schools that were offering 0 of these effective interventions were getting well below that recommendation. Schools that were offering 4 of the 5 programs were getting well above that recommendation, 40%. So schools that did nothing got half of what schools that had multiple whole-of-school approach to physical activity. With these same data, we looked at disparities in access to these programs. And this is the main finding there. The main socioeconomic status disparity was for having a physical education teacher. The low-income schools were less likely to have a PE teacher than high-income schools, and having a PE teacher was related to children's physical activity. So this is evidence of a disparity that we should be concerned about. Okay, I'm going to move on to early care and education. I'm just going to show you one paper, one study. This happens to be a review of the literature. In recent studies, 43 studies published in the last 5 or 6 years, focusing on children 3 to 5. So all of these studies evaluated interventions that were implemented in early care settings. We tried to do something a little different with this review. We tried to quantify the strength of the intervention, and this is what we mean by that. So each component of the intervention was quantified or coded for the intensity. And we considered if it was educational to either parents or kids, that was a low intensity. If they changed policy or environment, which changed the experience of the child every day in the setting, that was high. We looked at the frequency of the implementation of the strategy. We looked at the duration and coded the duration of the entire intervention. And then we made these summary scores for diet interventions, physical activity interventions, and parent components. Plus, we looked at the overall intervention score. And Diane Ward led this, and it was supported by healthy eating research. And these are the main findings. Our scores for the strength of the intervention for diet, physical activity, and combined interventions were correlated greater than 0.3 with at least one indicator of body fat or BMI. In other words, the stronger the intervention, the more likely it was to be effective in reducing or slowing down weight gain. In addition, when the strength of the parent engagement added to the effectiveness of each intervention category. So the diet, the physical activity, and the combined all had stronger relationships to body weight outcomes when parent engagement was added. There were mixed results about whether diet and physical activity separately or combined were more effective, and there was a strange finding that we can't fully explain, that the intervention strength was negatively related to the behavioral outcomes. So higher strength interventions related to better weight outcomes, but worse diet and physical activity outcomes. And I think it might be outliers in the small number of studies. But anyway, I think that's good news in the early child care and education that the interventions that are being evaluated do seem to work. Certainly a conclusion that I think is very important in the physical activity world is that many physical activity interventions are effective, but few are being widely implemented. So translation of the research into practice is the key. So as we've seen for both schools and early care settings, evidence supports multi-component policy and environment interventions. But these are challenging and can be costly to deliver. But if we want to be effective, we need to find a way to get these delivered. So how can we be more effective in attracting commitment and support for these approaches in schools and early care settings from education decision makers? I think a piece of good news, that's why it's in green, is that the new federal education bill makes more funding available for school physical activity. Okay, now we're going to step it up and talk about walking and walkability, consistent with the Surgeon General's call to action from last year. A little summary here. Where are we with walking for transportation versus walking for leisure? Both of which are walking, but they have different rates and different patterns across race and ethnic groups. So the light blue bars are the percent of people who do transportation walking at least once in the past week. And you can see there are not that many differences by race ethnicity, but the rates are pretty low, around 30%. There are bigger disparities in walking for leisure with whites and quote others, which I would assume a lot of those will be Asian Americans, are the highest, and then black non-Hispanics being quite a bit lower, 10 percentage points lower. So there are different patterns and different disparities there. Again, I want to use international data to put this in, some of this in context. And so let's look at walkability. Walkability is the design of a community so that people can walk from their home to other places they might want to go, like school or shopping or possibly a job. So I'm going to show just one piece of data from an international study that our group has coordinated in these 12 countries around the world. And so we use geographic information systems data to create a walkability index that is composed of residential density, the connectivity of the street network, and mixed use, or having destinations nearby. And I want to call your attention to the lowest walkability numbers, which include 4 cities in New Zealand and 2 regions of the US. They're the lowest, all right, among all of these 14 cities. And you can see some of these cities are much, much higher in their walkability. So this is something that we know, but I want you to see that we are among the least walkable cities in the world, countries in the world. But once you lay out a city, it's really hard to change it. It's going to be very difficult to fix the suburbs. But there are things that we can do that I think are a lot more feasible and can be done in the shorter term. And that's what I call the streetscape design, or getting the details right. And so here are some places that are pretty nice. I think you would enjoy walking around those. And let's take a tour in Clever, Missouri, about what can be done to improve a streetscape. So how could that be done? Well, this could be just about anywhere in America. A neglected, kind of rundown, poorly designed, boring and unpleasant place to walk. But what could you do with it? Well, you could take that auto care center and you could make it a nicer shop and put some housing above it. And all of a sudden, you've got some mixed use. Anything else? Yeah, let's put some more stores. Let's build up more activity in this area. Oh, and since you got more things for people to do, maybe they want to walk there. So why don't we put in a crosswalk so they don't get run over? And then there's all these people walking around there, and other businesses can say, hey, I want to get in on this, and people will want to live there. And wow, all of a sudden it's starting to look like a community. Can we make it better? Well, what can beat trees? Trees are great. And now you've got people bringing their kids in, people are coming to shop, you've got a nice community. And look where you can end up with the same structure, but different treatment of the streetscape, and planning for people to get around, not for cars to get around. Because the cars here are going to go faster than the cars here, even though it's the same road. So that's what you can do. So I want to give you a little bit of data that if you make changes, well, that the design of the streetscape matters. And so this is based on a tool we developed called Maps Mini, and it's an observational measure where you walk down the street and code different aspects that you see. And we started with 120 items. We made this short version for practitioners and advocates. We evaluated it in thousands of children, teens, older adults, and older adults in 3 regions of the country. And this is a little brief summary showing, I want to just highlight the bottom line. This grand score for active transport is most of these items except aesthetics. And if it's a colored box, that means it's significantly related to active transportation. So this grand score is significantly related to walking, mainly for transportation, in all age groups. So, this shows that the quality of the built environment can matter. But what about disparities in access to the built environment? This came up in the first panel today. And I want to highlight two papers from our group, one of them using a park quality measure, another one using this MAPS measure. They were just published earlier this year, and we had some surprising findings that I want to share that I think are intriguing. One is we didn't find a consistent set of disparities where the quality of these environments was worse in the low-income communities. That's not what we found. Sometimes we found those disparities. Sometimes we found what I call equitable differences, where the quality of these streetscapes or parks was better, significantly better, in the low-income neighborhoods. And we actually found some policies, especially in the Seattle-King County area, that might explain that. So so our data suggests that local policies can be effective in creating more equitable built environments. So my recommendation based on this is, given each city's unique patterns of environmental disparities, local measures, which might have to be based on observations, are necessary to assess local conditions as a basis for remediating disparities in these physical activity environments. So I think I'm going to leave it there, and thank you for your attention.